emergency room doctors usually see a 10% increase in patients during cold and flu season. And this year, they're bracing for even more people who are worried their flu-like symptoms could be something worse.
Due to the nature of what else is going on in the community and also in the world, especially with Ebola and enterovirus.
The virus's common symptoms, including fever, vomiting, and breathing issues, mimic the flu.
There is no healthier, more all-knowing, all-seeing, and all-well-meaning health expert available to us every day here at MidPoint than the man who taught Arnold Schwarzenegger everything he knows and was once considered for the role as the Incredible Hulk in the new Avengers film without the need of CGI. He unfortunately could not take it because of his duties here. Welcome back to MidPoint. Newsmax Deputy Health Editor and the original Hulk himself, Nick Tate, joins us on the show.
It's all true. It's all true, Red.
We would like to pump you up. All right, let's pump up everybody first of all here and talk. Let's put Ebola to bed here for one instance. The president was exactly correct in what he said over the weekend. You can criticize the man whatever you want. 2 cases of it in this country. Everybody that has sat through the quarantines right now has been cleared. Stop the panic, right?
I think that's right. You know, the wall-to-wall coverage has definitely contributed to a kind of panic in this country, and now people are showing up already in ERs. There was a story about a woman who came in and she said having gastrointestinal. She was pregnant, but she thought it was Ebola. So you know,
she didn't know she was pregnant.
No, so crazy. So you know, the panic we need to tamp down. Now, here's the truth: we do need to make sure that this does not become an outbreak in the country, and we need to be vigilant. We need to make sure that our healthcare workers are safe. But for the average American, there are bigger things to be concerned about right now. Flu being one of them. Kills 30,000 Americans a year. Pneumonia, another 20,000 Americans every year. Drug-resistant infections, 23,000 Americans every year. 2 million people are infected. So these are the things where our individual consumer focus needs to be. Get a flu shot, boost your immune system in any way you can, and don't be in a panic about Ebola yet. That's different from being vigilant and paying attention.
It is fair that you said yet, and you said vigilant and paying attention, because if there is a positive to come out of all this, is not it fair to say that it's been exposed, the lack of concern, the lack of imagination, the lack of preparedness from the CDC and so many others. They were taking their hooks from the people at the World Health Organization.
Sure.
They didn't get it right, so the CDC didn't get it right. So we have exposed so many cracks here that we're going to be looking at this for a lot of years, but we've got to get on it right away.
You're right. Let's hope that's the lesson. Let's hope that we can translate what we've learned already with a relatively small number of cases to apply it so that we don't have the big outbreak that everyone is worried about.
All right, but still, vigilance is
Yes.
certainly it. We have to be sure where we're standing. Now, I just want to go back on flu season one more time.
Yes.
Because it does kill more people
Sure.
than
Right.
Ebola.
Right.
Here comes one of those great questions of all time. What do you do if you don't get the shot? I mean, how much real danger are you in?
Well, you know, the folks who are really in danger are seniors, people with compromised immune systems, people who have respiratory problems, asthma, those kinds of things, young people, children. Those high-risk groups, it is very strongly recommended that they get the flu shot. But there are other things you can do. I mean, simple hand washing, making sure that if you're around people who appear to be sneezing and coughing, get away from them. If you're on a plane and you're traveling for the holidays and the person you're sitting next to appears to have some kind of respiratory disorder or infection, move your seat. So there are some things you can do. You can also boost your immune system through all the stuff that we always talk about. Exercise. Eat a healthy diet, make sure you're getting enough sleep at night, and de-stress.
Are we going to reach the point where, much like Japan, we are a citizenry walking around with masks on? Because if you look, everybody in Japan wears them. They seem to maybe know something we don't.
Well, I think what prompted that was SARS a few years ago. And in fact, SARS is spread through respiratory route. So it's actually not a bad idea when there's a big outbreak. We have not of flu or SARS or MERS. You can transmit it that way. We haven't seen that yet here. Some places you're seeing those masks now, and people are buying those moon suits, those space suits, just as a precaution. But it seems to me, and to a lot of health experts, that that's just panic.
All right, second part here, open enrollment now comes up for Medicaid, so here come the health scams.
That's right. Medicare actually started last week for seniors and people with disabilities, and whenever they open the doors for the sign-ups, they also open the doors to the scammers. So the Better Business Bureau and the FTC and others are now letting people know that if you're getting knocks on your door from individuals saying, well, Obamacare is going to change your Medicare, and to keep your Medicare, you need to buy this card. You need to give me your personal information, your bank account number, your Social Security number. It's a scam. Seniors often fall for this because they're confused. But the truth is that Obamacare does not have a direct impact on Medicare. Your Medicare plan, you can only sign up through the federal government website, medicare.gov. You can only sign up for Obamacare through healthcare.gov or through an insurance agent. So if somebody's knocking at your door and telling you, if you don't do this, 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 and this, you're going to lose your Medicare, or you're going to spend a lot more money, it's a scam.
Yeah, the fuller brush salesman doesn't come to the door anymore.
Not anymore.
It's
no.
not in the 21st century.
Not at all. You won't get a knock from federal officials at your door or a phone call saying, "Give me your stuff your information over the phone."
Yeah, go to medicare.gov. It's much easier. All right, health-wise, you need to walk 5 miles to burn off one soda. I love this because I've always loved the people who go into a fast food joint and go, I'll have this, I'll have this, I'll have this. Oh yeah, and I'll have a diet soda too.
Right.
It doesn't make a difference.
Well, there was a study that came out that said exactly that the labels that are required by federal law really aren't that helpful to people. If you look at a label and it says your soda has 250 calories, what does that mean? Well, this research shows that what it means is you need to walk at least 5 miles to burn off those calories and that sugar, or you need to be running or exercising for 50 minutes. What they did is the researchers put labels next to those drinks in convenience stores that not only told consumers what the calorie counts were for those products, but how much you'd have to work out to burn off those calories. And what they found is that when people saw what they had to put out in terms of energy expenditure for what they were drinking and eating, they didn't buy the sodas. They didn't buy those foods that are high calorie.
And I want to tell you this too. I recently had dinner someplace and they only had soft drinks. So I decided to get one of those drinks that claims that they are made from the best stuff on earth. I'm not going to mention their label right up front here. I looked at the back, 63 grams of sugar.
Yeah, crazy.
In the serving, 63. I don't know too much about exactly what my daily is, but I have a feeling it's a little bit more than I need on a daily basis.
It is, and really the more we find out, it's the sugar, it's the processed food, it's the flour that's really the problem. It's not even fatty foods that contribute to obesity, but those sugar counts are really high, and they're often hidden. Sometimes what you also find is it'll tell you what the serving is. Check the label.
Right.
That might have been per serving. There might have been 2 servings in that particular bottle.
There was actually 63 grams per serving, and then you go ahead. Actually, no, it was 1 serving for the bottle, 63 grams. But you're right. If you see 63 there, 2 servings, you're looking at 120 grams plus of sugar in 1 serving.
Go with the water.
Yeah. I don't know.
Go with the water.
I'm one of those old guys. I still like to have the flavored something. But you're right.
Or spend more time at the gym. You know, there's your choice.
Okay. Or have an adult beverage, which might even be healthier for you. You never know.
I'm all in for that.
A reminder, be sure now, go to healthradarnow.com to get your special offer on the Obamacare Survival Book. And Nick, thanks a lot for joining us. Always a pleasure to see you, my friend. Later on this hour, Al-Qaeda, it never went away.